Hi, my name is Stuart Beardwell. I'm the Director of Be Well Clinic and the Principal Osteopath. This is just a brief video to introduce you to what we do at the clinic and what to expect when you arrive. When you first arrive at the clinic, you'll be asked to fill in this form. This form just outlines our expectations of our patients and what you can expect from us. Then we need you to fill in your personal details, have a read of the privacy policy. There's some general information there about risk and benefits of osteopathic treatment. Have any questions about that, feel free to ask your osteopath during the treatment. To fill that in, you will need to bring your glasses. We do have some general reading glasses here if you forget, but if you have specific glasses, you will need to bring them. You can find this on our website and download it and fill it in before you come, if you wish. So when you make an appointment to see an osteopath, you can do that online now, or you can do that via our telephone booking service. When you actually arrive, in terms of parking, we've got 2 parking spaces outside. They aren't always available, so you need to leave enough time to find somewhere to park. You can park down in the town centre or in some of the streets around, but it's not always straightforward, particularly in busy rush hour periods. So do leave a good 10-15 minutes to find somewhere to park. When you arrive, your osteopath will ask to fill out the form, then they'll take you through, they'll go through your case history. It's really important to listen to your story. They want to know what you've done, how you've done it, what's happening in your life which may have contributed, all the sort of traumatic things in terms of direct physical trauma, but also the stresses which may be contributing, and also some of the behavioural issues which might need to be addressed in order to prevent the problem from happening again. The treatment itself is all fairly hands-on. What we try and do in Be Well Clinic is adapt the treatment to the patient. So if you're a 24-year-old rugby player, you might experience a different, stronger kind of treatment to if you're a tried 75-year-old. Depending on the state of the body. So we can offer very gentle treatments, and we can also offer stronger treatments depending on how the body is capable of reacting. Within the treatment itself, you will get a full assessment and hands-on treatment and an explanation of why you have the problem and what you can do to prevent it. Initially, we don't tend to give exercises on the first session because we want the patient just to take on board the initial advice, but we will follow up with exercises, and there are videos on our website that the osteopath will recommend to you for your specific condition. With anything which occurs to the body, there's a number of levels which we need to take it at. We need to look at the mechanical impact, we need to look at the psychological reasons why that's happened, and that can be how you're sitting at work, that can be how you're sitting at home, it can be the position that you play in rugby or your attitude to racing your bike. There are various different things that we can look at as to why you've got that injury and how you may be able to avoid that in the future. So an osteopathic treatment by its nature is hands-on. After you've had a full assessment, the osteopath will be discussing with you how it's feeling, what you think you've done as you go through the assessment. He'll also explain what he thinks has happened, so you can avoid it in the future. As I said, the treatment's fairly hands-on, so there's a number of things to think about there. Most osteopaths prefer to work on the skin than through clothing, but they can work through clothing if you're uncomfortable with taking your clothes off. Things to avoid are very tight clothing and very thick clothing. Things like jeans do limit how you can work. So it's good to wear either big underpants or leggings or trackies or something like that, and then we can work through that. Also good if you've got long hair to bring something to tie it back with, just so we can see your neck. If you have any questions during the treatment, anything you're uncertain of or anything you're unhappy with, do tell the osteopath there and then, because then they can change what they're doing or discuss the issue with you. So we need to talk about consent to treatment. We need to get your formalised consent written down that you want treatment, but also consent is a process. So nothing should happen to you within this room that you're not totally happy with. So if there's anything you're not happy with, do say so. But the osteopath will ask before he carries out any procedures like manipulations or touches any areas which are intimate, and get your consent and record it. Similarly, if we're dealing with children, anyone under 16 must be accompanied by an adult so we can get there, and it usually has to be a parent or guardian unless there's some pre-arrangement with the clinic. So I hope that's been of use. If you have any questions or queries, get in touch with the clinic and we'll get back to you. Hope to see you in the clinic sometime soon. Take care, bye now.